The Medicare enrollment deadline is this Saturday, and many seniors are feeling the pressure. Don't just let your plan auto-renew, especially if there are changes in your health needs. Our next guest can clear up the confusion and help you choose the right plan for free. They offer accessible, affordable, and culturally sensitive options designed specifically for underserved communities. Here with details on getting the most out of your Medicare are Dorothy Chan and Chris Bond from Verda Healthcare of Texas. All right, good morning, welcome back.
Good morning.
Okay, I know what's happening right now. So as the holidays start, everybody gets crazy, and then the pressure of that deadline's coming around, and I think a lot of people might be putting their head in the sand and go, I'll just let it auto-renew. But as I mentioned, that could cost you some things. A lot of people would argue that seniors among themselves are kind of an underserved community. A lot of them are. But there's a subset that you all focus on that's even more underserved.
Absolutely. You know, we actually serve member you're talking about in different languages and, you know, language specific and cultural sensitive. You know, like, again, our plan actually designed for people that who speak different languages, and you know, like, and the benefit it's catered.
Yeah, they're residents here, so they're eligible for Medicare. They're residents here, but you know, your Asian American and Hispanic and Arab American communities, and a lot of those folks, if they're especially first generation here, don't even really understand. First of all, none of us really understand the Medicare system. You just know that you need it. When you're talking about government programs, sometimes it's hard to negotiate. But when you come from countries that never even had a Medicare program, this is really new to them. But language barriers, we know in Houston is a big one. You all have language access services and a diverse staff of representation.
That's right. So we actually do hire in-house staff member who actually speak the native language rather than using a language line. It could make it very difficult for many of them.
I would suspect a lot of people don't even pick up the phone because they know that they have that language barrier, but they can do that with your program. To show just how specific you can get, there's a thing called Bird's Nest. Now, I grew up in Asia, so I know Bird's Nest is like a really important health item for a lot of people. You can make sure people can kind of access that.
Yes, for 2025, we do have a new benefit. It's a nutrition care that, you know, cover for a alternative medicines. You know, it's something different than the normal plan that offer.
Yeah. All right, Chris, you offer a zero copay. There's a lot you can get at that zero copay.
Zero copay. It's zero premium for the plan.
Yeah.
Zero copay for your primary care physicians and your specialists. And most importantly, it's the inpatient hospitalization and urgent care that is also zero, which is a big differentiator for Verda Health Plan.
Lab services and routine x-rays, tier 1 and 2 prescription drugs, including select insulins, because all that stuff we just mentioned, you can work your whole life and save for retirement. Any one of those things could wipe out that retirement if you don't have this Medicare protection.
That's right. And you mentioned zero for select insulins, which is huge. I mean, their insulins are very expensive, and it's a very critical prescription drug for diabetics, and we have a plan that is specifically for diabetics with our Verda Noble Chronic Care Plan.
Yeah, there's your direct health care things that you just mentioned, and then there are other things that just keep people's soul kind of healthy and happy, but you have up to $3,280 annually in some extra benefits in one of your plans.
Yeah, and it's actually amongst both of our plans. It's the totality of what you can actually get in extra benefits, whether that's, we have dental, vision, and hearing, which is an important benefit for the plan, and for beneficiaries rather, but we have unlimited transportation. We have what other benefits do we have?
Silver and Fit,
Silver and Fit,
grocery benefit,
which grocery benefit is probably one of the most important benefits, I think, for a lot of beneficiaries right now, especially in the underserved communities. It's a big benefit in an economical challenged environment for seniors.
Another one is basically some relief for caretakers.
That's right. Our companionship benefit, you can get up to 30 hours of companionship benefits through our HMO plan, or up to 60 hours through our chronic Care Noble plan that we mentioned.
Unlimited transportation, beauty spa, thank you. Ethel, you can get that hair done, right? But these are things that really, I talked about kind of feed the soul, right?
Yeah.
And keep their state of mind great as well. But you know, the max out of pocket can be $1,099, the maximum out of pocket.
Yeah, that's the Chronic Care Noble plan. And so when you think about emergency room visit, it's a $90 copay. Those co-payments go towards that maximum out of pocket. So you look at it as a predictability of knowing what you're going to have, the maximum out of pocket, and gives you peace of mind ultimately.
Yeah, one of the other things, we know with so many seniors, they close the door, they're inside those walls, and nobody hears from them, and they're lonely. You help seniors get social with your Member Resource Center that opened earlier this year.
Yeah, and we actually have a Christmas party today for our members. So we're very proud of the Member Resource Center. It's getting a lot of traffic, and yeah, it's a great opportunity for them to get out, socialize, and I think that's just great. It's great for everybody because they get to make friends, and it's just great social interaction.
Yeah, because America's a little different. I know around the world, a lot of families, your elders actually live in the house with you, right? It's like several generations under one roof. And in America, oftentimes we don't have that. So they don't have the grandkids around, the kids around, so they can go to these centers and have game nights, painting classes, tea parties. Look, I'm not afraid to retire now. Can I qualify in this right here? But tell us who qualifies. We talked about underserved communities and especially different cultures and things, but in certain counties, right?
Yep, we're actually in Montgomery, Harris, and Fort Bend counties, and people who are actually entitled to Medicare Part A and B, so they qualify. So don't wait.
Yeah, when you say don't wait, how important, when we say don't, we really mean don't wait, because it is so tempting to just say, I don't want to face it, but this is the great part. You don't have to deal with all the details. You will take the time to explain it to them, and it is free. You're not charging them anything.
Absolutely. We have people standing by right now. I think if you have a physician that's in our network, which we have a great network of provider partners, and we have your prescription drugs, and you're looking for these additional benefits, this is the plan for you to choose. If not, and that's okay too, but everybody has friends and family that are eligible for Medicare, and so we want to help as many people as we can.
And if you auto-renew, the problem is, again, as I mentioned at the top, if you have some health needs that have changed, that could cost you. You're leaving money on the table.
That's right.
And the other thing, of course, is that you have no idea what the changes have been, because there have been some changes, and you're missing out on that too.
Yeah, I think it's important every year to make sure that you're getting the most for your dollars.
Yeah.
And making sure that you're looking at all the benefits that are available to you, and if everything's going well and there's no problems, no pain points that you're experiencing, then maybe it is best to stay with your plan, but you should always do that due diligence.
And the help is free. Don't wait. Peace of mind is just a call away. When you choose Verda Health Plan of Texas, you will get $0 copays for PCPs, specialists, hospital visits, urgent care, and Tier 1 and 2 prescriptions. Suddenly getting older is not scaring me. Plus, enjoy up to $3,280 annually in extra benefits to keep you healthy. You can enroll now through December 7th. That is this Saturday. Call this number, 877-419-2730. Again, that number to call is 877-419-2730, or log on to verdahealthcare.com. And Verda, you see there, spelled Verda.